Mordecai, one of your newest video that you've done is talking about nursing in a nursing home and nursing in the NHS. Could you just give us a bit of summary about that, please?
Yes, I really like that video because sometimes as YouTubers we do videos on things that we don't have personal experience with, okay? We do videos on topics that we've read or we've heard from somewhere. But this video is a personal experience. It's something that I've gone through myself because I worked for 3 years in a nursing home and I'm currently working with an NHS hospital. So you need the same qualification, okay, to work in both facilities. You need the same qualification. That is to be a registered nurse or a registered mental health nurse. You can work in a hospital, you can work in a care home. But the practice of nursing is quite different. The differences here is the hospital is an acute setting, okay, where we take care of acute illnesses and sometimes long-term illnesses. In the hospital, we treat your sickness or we help you achieve a level of stability before we discharge you. You are not admitted into the hospital forever. No. Except when you are in end of life care or palliative care, where we know that you don't have much time to live on earth. So you are kept in the hospital until you pass away. But this is not the same thing in care homes. Care home is a long-term facility where we provide long-term care to patients or not so to residents with long-term illnesses. And in care homes, usually we have the elderly patient, and there are some care homes that also take care of patients with learning disability. Okay, now in care homes with the elderly patient, most of them have mental health illnesses. We have our dementia, where Alzheimer disease tops it all. We have schizophrenia, okay, we have depression, we have our bipolar disorders, okay, we have so many mental health illnesses in the care home. And these are long-term, not acute illnesses. And I have to say, if somebody in a care home gets any acute serious illness, the person is actually transferred to a hospital for treatment. And when they get treated, they are transferred back.
That's
In the
really good.
care home, a lot of things happen, okay? So as part of your scope of work, let me take medication. In the care home, we don't administer intravenous medications. Um, we administer intramuscular and subcut medications. We administer oral, topical medication, rectal medications, okay, but no intramuscular medication. So no intravenous, sorry, no intravenous medication. So you realize that in the care home, we don't have things like central venous access devices. We don't have PIC lines. We don't have other deep intravenous tunnels or medication administering instruments. All these are found in the hospital. Okay. Now, you also realize that in the care home, they do very well when it comes to salary. They pay very well. The salary in care home is very good. And I was receiving about £20 in my care home, okay, only to come to the NHS and receive something very low, very, very low, okay, than that. But I joined the NHS because the NHS give other advantages that I think outweighs the money that you earn in a care home. And this is career development. And look, this is very important. I tell people that within 6 months of joining the NHS, I studied so much, which in turn was more than what I've studied all the 3 years I worked in a care home. Okay, I did a lot of courses and I got to know so many aspects of nursing. I've done shifts in a lot of specialty in the hospital. So it's not like the care home where you worked only one specialty, mental health, or learning disability. In the hospital, there are so many places to work there. Also in the hospital, some of the things that they do is, NHS workers, we have a lot of benefits, okay? We have discounts and you can use this discount to buy a lot of things, something that most private nursing home will not offer you. And I also did speak about sick leave and maternity leave, where in the NHS, yes, you can't call in sick forever, but in the first few couple of times that you call in sick, you are likely to be paid depending on the hospital's sick leave policy. But in the care home, this is not like that. Most care homes, you only get paid when you go to work. So just those who want to join care home, just bear in mind. Okay. Now, something also in care home that you face is sometimes, and I know I didn't say this in my video, but I want to say this first on your video here.
Really good.
Sometimes you tend not to do things that are related to your nursing work. Okay. So, example, if the cook in the kitchen calls in sick, somebody would have to go and support. And sometimes you are pulled from your nursing work to go to the kitchen. Sometimes, too, when the person doing the laundry calls in sick, the laundry has to be done. Somebody from the nursing team have to be pulled to the laundry room to do it. So there are some few occasions where in the care home, in some situations, you don't do things that are related to your nursing work. You can't see this in NHS hospitals.
Yeah.
Well, I don't care if the cook doesn't come to work in the NHS hospital. That is their problem. I am specifically at work doing my nursing job per my nursing job description. Okay, so these and more are some of the differences in working in a care home and in NHS hospital.
And I think one of the reasons for that is because of the size, the sheer size of the NHS compared to the
Yeah.
sheer size of the nursing home. I mean,
Okay.
another good thing about NHS is that they've, for those who are staying for a long period of time, the pension scheme is very, very good. It's
That's
something
good.
that everybody in the NHS talk about. They've got really good pension
Yes,
scheme.
that's good.